talk about fibroids, fibroids are uterine masses. They are growths on the uterus. They are usually solid growths. They grow, could be 1, could be 2, could be more than even 3. They grow in different sizes, and they also grow at different sites on the uterus. They could grow just beneath the inner lining of the uterus. We call them submucosal fibroids. They could grow within the wall of the uterus. We call them intramural fibroids. We have those that grow just outside the uterus. We call them subserosal fibroids. They could just grow and they have a stalk and they hang onto the uterus. We call those pedunculated fibroids. The pedunculated fibroids can still as well grow on the inner side, inside the cavity of the uterus. And thus we call them intracavitary fibroids, but when they're pedunculated as well. What causes fibroids? There's no clear cause of fibroids, but being a woman with a uterus, then you're already at risk of developing fibroids. 2, nulliparity. Nulliparity means not having children is a known risk factor. It doesn't mean that whoever has not carried children will develop fibroids, but it is a known risk factor. And also we've noticed family history of uterine fibroids. So we see people who have a family history of uterine fibroids also developing fibroids. Then another known, we also have lifestyle. If I'm to talk about it, we could be a known risk factor could be alcohol and drug abuse. Smoking has been implicated to cause uterine fibroids. Yeah, so those are known risk factors of fibroids. We do not call them causes, we just call them risk factors. Fibroids can be managed. We have different modalities of management, and still the different modalities are tailored towards the size of the fibroids and how the patient is presenting. We have different options. One is medical, where you give the patient 3 monthly injections that take the periods away. This type of treatment is helps it can be used as a way of preparation for surgical removal to also improve the patient's symptoms. If this patient has been having heavy menses, these 3 monthly injections take away the period, so this patient can be able to not to have the stability. It reduces that they stop getting the problems that come with heavy menstrual bleeding. It also helps improve the clinical picture. If this patient, the blood level tends to go up when you're on this medication. We tend to use these injections as a way of preparation for surgical removal. The other treatment of fibroids is surgical removal, and there we talk about maybe the open myomectomy. This is where we give the conventional incision on the abdomen to go and remove the fibroids. We usually do it for very big fibroids. For the smaller fibroids, I'll need to discuss the new era or the new type of management that we're having is laparoscopy, where you're using pinhole surgery to remove fibroids. Relatively, we're now even going for even the bigger fibroids, where it is non-invasive, it's less painful, and the recovery is a little bit faster compared to the conventional open myomectomy.